Hello, and thank you for taking the time to stop by and hear about this small exploratory cross-sectional study titled Experience of Children with Special Education Needs During COVID-19. I'm Chioma Torres. I'm a developmental and behavioral pediatrician at Michigan State University. We know that about 57 million children who are school age in the US experienced school closures during COVID-19. It's estimated that 14% of school-age students received special education services during that 2020 to 2021 school year. This population of children with disabilities and special education needs were typically excluded from studies like this, or they were done outside of the US. So we examined experiences of children and their caregivers based on the school learning format of virtual, hybrid, or in-person learning, behavioral differences and learning challenges, along with parental stress of children with and without an individualized education program or an IEP during the 2020 to 2021 school year. Approximately 300 parents of 5 to 10-year-olds were recruited and completed an online survey where they also completed a strengths and difficulty questionnaire, parent stress scale, and Centers for Epidemiologic Studies depression scale. We conducted bivariate analyses to examine differences in experiences with and without IEPs. 71% of the sample was non-Hispanic white, 47% had an IEP. 36% reported not receiving sufficient IEP supports. Of those, 41% stated their IEPs were unavailable. 12% could not bring their child to school during remote or hybrid learning. And 47% reported virtual IEP services were available, but just didn't work well for their child. Of those with IEPs, 40% started a new therapy outside of school, like speech therapy. 13% started a new medication for attention, behavior, or emotions. Parents of children with IEPs reported higher hyperactivity, peer problems, and behavior difficulties for their child. Children with IEPs were also less likely to be meeting grade level for reading, math, and writing, and they were less likely to have a close friend. Children with IEPs and remote learning had higher parent depression symptoms, but not significant parent stress scores. Overall, 1/3 of parents of children with IEPs reported their child's learning needs were not met during COVID-19 pandemic. And if remote learning is needed again, we can use studies like this to help tailor supports for those with IEPs and add compensatory supports to focus on social skills and well-being along with instruction. Thank you for your attention, and please take the time to read the article in the Journal of Developmental and Behavioral Pediatrics. And thank you for your time.